everyone. Mark and I are going to talk to you about Xpert Eye, which is a See What I See solution, which some of you might have seen on the booth. We will detail a few use cases from both the industry and the medical field. So let's just dive in. I'm seeing the slides are here. All right, so just a few words about who we are. AMA has been around for a little over a decade. We were launched by one of the co-founders of Ubisoft, which is a big video game company, back in London, in the UK. I would say 4 years ago, when Google Glass first came out, we were one of the first Google Glass explorers back in France. First, we did try to do what we knew how to do best. We did put video games on it. That did not quite work out. There was some buzz around the community, the local community, around us having our hands on those big Google Glasses. And the medical community did reach out to us very quickly to see how we could help them save time and potentially lives with a See What I See solution. So that's how we got on track. Where am I? Okay. So our solution comes with either a PC or a mobile phone. And I think what's really important to know is that we are working, even though we started this glass project with Google Glasses, we are completely vendor neutral. So you have a few examples here on the slides, Google Glass, ODG, R7, the Vuzix, CME, and many other ones. So what we're aiming to do is to have a mobile application that lets the person on the field keep their hands free while saving time and hopefully very cost effective. So for who are these applications? Field operators. That can be true in the field of maintenance, in the security area, in education and training, that is huge. First medical responder, or first responder even in general. And to be very frank, and I think we all agree from all the talks we've heard today, we only uncovered a very, very small portion of the spectrum of potential applications. So how does it work? Very briefly, we have someone here who's on the left-hand side who's a field operator. That can be someone in an ambulance, a paramedic. That can be a field technician in any industry, really. And so that person is facing some type of challenge, needs some external expertise. And instead of waiting for an external expert to get there, he's going to put his glass and basically use Xpert Eye as a screen share of his eyes. The solution will allow him or her to augment his vision because he will have, of course, audio and video feedbacks. But the remote observer will also be able to push data to that person, whether it's a protocol, whether it's an image, or even sometimes annotate the field of view. So we'll let Mark continue.
Oh, you bet. Thank you, Anne. So Peggy gave a great presentation earlier on from AGCO with regard to how to use the glass in order to access content that was already available, and asynchronously stored, if you will. This is really a solution that's about enabling the second half of that, which is the real-time expert and getting that communication and collaboration. And what AMA has done so well is to optimize the experience on the glass by using the glass itself as the peripheral device, if you will, and offloading a lot of the heavy lift down to a sister device, whether it's a smartphone or a laptop, as you might have seen in the previous picture. And the reason why that's important is because when you're doing real-time communication, there's a different need with regard to the capabilities of that system, because it has impact on the frame rate and the naturalness of the video that gets transmitted. Video's part in that story is that we provide the back-end video communications and collaboration platform. It's a very horizontal platform that enables folks to be able to pull in all kinds of different mission-critical communications aspects of their business off of one platform. I focus on the healthcare space, so I can speak specifically to that. But to give you an idea, in healthcare, we support lines of business for service delivery, everything from tele-ICUs to video visits between patients and clinicians, to telestroke type applications and so on and so forth. But we also support the ability for people to connect with prospective patients as kind of a customer engagement type of a thing. We also enable the communications internally amongst folks. So it's this one unifying platform that connects all different types of devices, of which the see what I see type of capability ends up becoming an extension and another endpoint within that space, if you will. So all software based and tightly integrated. And kind of, the reason that Vidyo works so well in the smart glass space and to provide this capability is because, flexibility in terms of the deployment, whether an enterprise has enterprise video in their own network or getting that from the cloud, a technology that dynamically adapts to the environments where you use the smart glass, where you're on a 3G or a 4G network and you need to compensate for lots of packet loss and that sort of thing. That's kind of our secret sauce and forte. And then the customization. It's all software-based APIs so that we can embed into the devices and the applications and such. And of course, when you start talking about field services, you've got lots and lots of folks out on the street. You need to be able to scale to very large sizes, and that's part and parcel to what it is that we do. So having said that, I'm going to turn it back over to
Sure,
Anne.
thank you. So basically just a few words about that digital matrix that we are all entering right now. Whoops, I'm having issues with the buttons. So I think it's mainly serving three objectives, and I think we all agree on that. We're looking to expand our market in the enterprise, better serve our customers, being more proactive, being more reactive, and overall reducing the cost of operations. And so the way we're going to do this, we're going to use four main means, if I may say, and we're completely in it here. So we're managing complex environments using a virtual environment with a hardware that's even more adaptable and, of course, hardware that is fully connected. So having said that, I believe, I'm sorry, we can go over these questions at the end. We have a video that we wanted to share with you to discuss real use cases from GE with Greg Lopata in the energy sector with GE, and with Dr. Kennedy from Baptist Health, so for the health sector. So we can watch the video.
And within GE Industrial Solutions, we manufacture basically end-to-end power solutions and energy solutions for telecom and datacom companies. And we have a variety of use cases that we see really being able to take advantage of a hands-free, real-time telepresence solutions. We have field engineers across the globe that perform work both pre-award and post-award. From a pre-award perspective, we could really use a solution like this, where we can send out more local, lower-cost labor to perform some bid walks for our customers. Well, now, if we have something like this, we can send out more localized labor, even outside of our industry, to be able to use a pair of smart glasses with the real-time telepresence solution that Vidyo offers, to be able to walk through an office, be able to look up at the cable rack, look at the different cable paths, look down at the ground, make sure there's floor space available. And Vidyo's solution offers multi-node connectivity. So we could live stream that back to our commercial organization, who can sit there and essentially prepare the quote live in real time and simultaneously transmit it back to our qualified labor effort estimation team. And we could simultaneously have a conversation with our field rep, being able to use both of his hands, monitoring a controller and opening up a distribution frame. In that particular use case, it would really save a lot of T&L costs for our entire organization, and it should ensure that our quote labor effort has been optimized for accuracy. So it really eliminates a lot of the guesswork.
So what we're thinking basically in a healthcare environment, with Baptist Health, we're the largest healthcare provider in the state of Arkansas. So the initial thought was we would put it in, say, we'll put it on a crash cart. So we have a rapid response team, and anytime there's an issue on the floor, they grab this crash cart and run to the patient. We're thinking, hey, let's take these wearables and place them on this cart for the nurses to use and have a physician that can oversee what's going on. Just have that extra set of hands or eyes in the background to help guide you on taking care of that patient. The other thing we're thinking about beyond that is why can't we put them on the ambulance? Why can't we use them in the helicopter? Anywhere where we've got to send a paramedic, an EMT, or a nurse in the field, let's equip them with these wearables so that we can have a physician, say in a telehealth center, assist during these critical times. I need it to be easy to use. If it takes a minute or two for the nurse to get it, logged in, set up, and ready to go, that's too long. It needs to be, very simple to use. A device they just put the glasses on, connect to the call, or have the physician connect automatically to the device. That's critical. And the other thing, it needs to be wearable because it's important that they're able to use their hands and that the physician on the other end be able to see exactly what they are seeing.
So I agree with what Danny had mentioned with ease of use. These devices are going to be used primarily in the field by individuals who, aren't, the most computer savvy. So immediate connectivity isn't necessary. These devices have to be worn for my use case along with safety glasses. It is an absolute EHS requirement and safety requirement that all of our field techs who would be utilizing a hands-free device like this requires safety glasses, especially in some of these areas that we work. We have to ensure that the hands-free device has a high enough battery capacity to last at least an hour while on a video cloud and video conference session. I need to ensure that the frame rate stays relatively high while still maintaining clear multi-way audio transmission. If the frame rate stays, I would say at a minimum of 12 frames per second, that would be fine. Certainly the frame rate I'm experiencing using the video desktop and video mobile on a regular mobile device, such as a smartphone or a tablet, is crystal clear. And that's the sort of performance that we would require from a hands-free device. And honestly, the last thing I would say is being able to still transmit effectively in relatively low bandwidth conditions. We won't always have access to a Wi-Fi network out in our field. We're working sometimes in data centers and in wireless switching centers for telecom service providers where we won't have Wi-Fi. So if we have access to a 4G connection or possibly even down to a 3G connection, we would need to ensure that in relatively low bandwidth conditions such as those, the solution is still effective.
Here, if we can save one life, I think it's worth it. Just that one, car crash victim or that one stroke victim that we were able to get TPA administered to while they were in the field, possibly. We don't know. But just if we can save one life, I think it's going to be completely worth it.
My field engineers are routinely working in high voltage, high risk environments. And unfortunately, accidents do happen. But being able to have a wearable device live streaming HD video and audio back to a qualified technician as they're performing a method of procedure outlined and already vetted by our quality and EHS organizations would certainly be helpful in ensuring safety. But another way that we would help gauge success is I would say the most obvious example is a reduction in T&L costs. One of our use cases would be to use this for product training. Right now, in order to conduct hands-on product training, it requires that we take a relatively large and dispersed geographically organization and fly them all into a centralized location to perform trainings. And because of the logistical nightmare of something like that, we don't get a chance to conduct on-site hands-on training as often as we would like. Well, obviously, with something like this, our trainer can wear this device, perform with his two hands all of the product training and actual hands-on requirements, stream that through a line-of-sight, see-what-I-see perspective to all of our remote technicians without requiring that they come on site, and certainly it reduces costs significantly.
Do you want to start over?
Yeah. Very good. And we're back. So you have the clicker?
Sorry, thank you.
So
yeah, that was testimonies from two different fields as they are assessing the use of the see-what-I-see solution on the field in their respective arena. And so just a few words. We have quite a few proof of concepts currently going on, and we're starting to move as all the people right now in this industry. We have to pilot and assess together the criteria for success, and we're starting to move to larger scale deployments. So here are a few examples of users, and we're happy to take any questions you may have now.
Yeah, and just to expand a little bit upon some of the feedback that we got from specifically GE and from Baptist Health and their trials. So they started by trying to run our native client directly on the smart glass. And they found a few things. Number one, you heard them in the video talk about ease of use. The client is not optimized for the user interface, if you will, on the smart glass. So it was way too cumbersome for somebody to use in that capacity. Could the client be modified to make it easier? Sure, you could do that. But there are better ways of managing that user interface. Secondly,
just jump on this point. I think one pretty cool thing about our not very typical story as a company at AMA is that coming from the video game industry, one of our first criteria for the first product launch was a plug-and-play system. And many of you have come by our booth. You might have seen you are able to use it with absolutely no training. It's very self-explanatory, and worst case scenario, I would say, within 15 minutes, if you already use a cell phone, you can really get it completely. So.
Yep, absolutely. So that's a great point. Another piece of feedback they gave is because, like I said, the processing is intense when you're doing real-time coding of video effectively on the glass, and the computer's right next to your head. The computer got very hot in a very short period of time. So that was something else that they wanted to be able to offload that so that they wouldn't have the heat condition. Obviously, the battery life becomes another challenge in the context of smart glass by itself, which is another reason why having a sister device made it a whole lot easier. So that type of feedback is really what drove the partnership between AMA and Vidyo. We've had these customers who had the video platform for other purposes, had these great field services applications, and AMA had a solution that addressed the specific concerns that they had.
Thank you.
Yeah. Yes, sir.
I really do like the idea of putting some of the compute power on the phone.
Yeah.
Have you thought about it not being tethered?
So, yes, we have. Actually, that's one thing that Greg was mentioning on the video. Security of your data and battery life are the main reasons why our solution is tethered to it's a hardware companion. So in the telemedicine world, sometimes the patient needs to be a third person in the conversation. So that's why we have the PC version, to have a big screen. They know who they're talking to. And the mobile version, the mobile is going to encrypt the video first and also provide the energy to the glass. So that's the, and to go back to the, yeah.
In a manufacturing environment, we have a lot of rotating equipment.
I know,
Tethered,
I understand.
a safety hazard, so we would sacrifice battery life by keeping it untethered.
No, yeah.
But
We have
if you did Bluetooth, you'd have a lower powered radio,
Mm-hmm.
and the computing would still be happening on the phone, so that would still retain some battery life in
Yeah.
that way.
I agree, and I perfectly understand your point. We have encountered this feedback, and one thing to know is that you don't need that. I mean, as an end user, you don't need to be looking at that phone. So people will put it under. It might sound like a workaround it, but they will put it under their clothes or in their back pocket and completely forget about it, and they are not bothered by the cable. Another point, we actually started doing that for surgery to make sure that that cable is not in the sterile field, right? We use it's a pretty simple workaround, but we clip the cable to make sure that it will never be in your way as you're doing whatever it is that you have to do. But point taken.
Yeah, your point's very well taken. It's something to continue to explore and see how that can be addressed, for sure. Any other questions? Good.
All right. Thank you very much.